Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Autism or autism spectrum disorder is a complex condition that affects communication, behavior, and social interactions. It typically emerges in early childhood and presents a range of challenges, including difficulties with social cues, communication, and repetitive behaviors. The demand for personalized interventions to meet the particular requirements of those with autism is increasing as the condition's prevalence rises. Parents of children with autism face particular difficulties in maintaining their children's oral hygiene and dental visits, which calls for a compassionate approach that is essential to effectively meeting their specific needs. We therefore hope that our discussion on oral health management of autistic children is a crucial component of this effort. Hello everyone, I'm Dr. Samya Saluja from THIP Media, and today we'll discuss oral health management of autistic children with Dr. Shivani Singh Mehta, who will help us explore evidence-based strategies for promoting oral health and overall well-being for these exceptional children and their families. Dr. Shivani Singh is a dedicated pediatric dentist and dental in charge at MGM Hospital and Research Center in CBD, Belapur, Navi Mumbai. Dr. Shivani is highly experienced and skilled in providing top-notch dental care specifically for children. Dr. Shivani stresses the importance of milk teeth in a child's development and aims to educate parents and carers about their significance. She also highlights the need for proper dental care to maintain healthy milk teeth. Moreover, ma'am is highly dedicated to promoting children's oral health and prioritizes the overall growth and well-being of every child under her care. Dr. Shivani, THIP Media welcomes you, ma'am.
Hello, ma'am. How are you?
I'm absolutely fine. And thank you so much for joining us today for this important session for autistic children.
I'm really glad to be here today.
Thank you. Okay, so Dr. Shivani, as you are well aware that autistic children have distinctive needs as far as their oral health is concerned. So could you provide an overview of the specific oral health problems that dental experts typically observe when examining a child with autism?
Okay. So, if we go to talk about autistic people, very firstly, we need to understand what autism means. So, autistic children are basically those who have neurological developmental delays or disabilities when it is considered. And the main finding is lack of communication with
Okay,
other humans. Okay. And a very common finding in them is also repetitive behavior. So
right,
when a patient comes into our dental office and the patient is an autistic child,
right,
very common dental findings that we find are first mainly related to the oral health. We find dental caries. See,
right,
these children tend to prefer eating softer kind of food. Okay, softer
right,
food means no chewing, and the food will also remain in their mouth because these children also tend to hold the food in mouth. They pouch the food in the
right,
buccal cavity or the cheek area, right? So
right,
if food remains in these cavities for a long time, the tooth will start decaying. The acidic pH of the mouth will remain high for longer and thus it will decay teeth. So dental
right,
caries is highly prevalent. Although there are a few studies which mentions that dental caries is comparatively less, but in my findings it has been like that only that dental caries are high. Other
right,
than uh, these children are on a lot of medications to suppress their anxiety levels and many of other medications that are given. These medications are responsible to reduce the amount of salivation. The
right,
condition we call it as xerostomia. In cases of xerostomia also, swallowing becomes difficult for these children. The
Absolutely.
autistic children also tend to have larger tongue or edematous tongue. That
Oh,
also creates difficulty in swallowing.
right.
Being a special child, especially having a neurological disorder where even minor amount of sensation is very much amplified for these children, brushing and flossing, the normal oral hygiene practices that we do becomes very difficult. So
Oh,
not practicing oral hygiene results in gum diseases also. So these
right.
are a few dental problems which are very prevalent. Other than that, there are malocclusions which can be seen, and a few more.
Okay. So, as you just mentioned, that these children, they usually come with a high prevalence of dental caries. They'll be having gum problems. They have non-aligned teeth, or they'll be malaligned teeth. So, how do you evaluate the particular oral health requirements of autistic children? As you just mentioned, that there would be communication difficulties. I'm sure, being a neurological disorder, these children might be having motor skill limits, and there might also be certain co-occurring conditions like teeth grinding or oral hygiene issues. So, how do you evaluate the oral health requirements for such people or for such children?
Okay. So first of all, before evaluating, we have to consider what amount of adaptation or sensitization the child has towards a dental appointment. Most probably, especially when we consider India, where approximately we have 18 million children suffering from autism, not many go for a dental appointment. Uh,
Right,
we prefer having a concept of dental home, like we have medical home, similarly dental
right,
home for these children, so that these children are sensitized at a very young age for the sensations of having something in your mouth, or some other person's hand inside your mouth to evaluate to function for something. Now,
absolutely.
when these children come in, a lot of patience being a dentist is required.
Right,
It's not easy to just go and check like any other child. No, you will have
right,
to build a trust level in the child first so that he comes and sits in your chair. Otherwise,
right,
you will never be able to even look into the child. The child will throw n number of tantrums. But
right,
if the child starts to trust you, believe in you, he will cooperate with you. Okay.
right,
So trust becomes really important. Behavior guidance is also there. Whenever we are
right,
doing anything, we need to tell the patient, okay, we are going to do this procedure. The term is like we follow tell show do technique. Okay.
right,
Uh, to evaluate this patient, when we take this patient on chair and we ask the patient to open their mouth, okay,
right.
there are many things that the child is seeing. So there is
Okay,
a lot of light above the dental chair that is there, which is irritating the child. So
right,
instead of using the chair light, we can go ahead using a headlight. Okay. After that, when we are checking, we can just evaluate without using the mouth mirror first, so that we have an idea which section to start with. The
right,
more prone sections can be checked first, so that the
right.
prioritized treatment can be performed. Other than that, there are various aspects to it where we can go ahead and just ask the parent what uh, difficulties are they finding, or what
Right.
complaints are they having, which they find in day to day life, so that we can address it.
So, as you just mentioned, that you need a lot of patience, and we need a lot of, we need to modify our ways as dental professionals when we address oral conditions in such children. So, I am going to lay a lot of emphasis on the communication skills of especially a child specialist for oral health conditions. So, do you have to modify your communication style to meet their particular requirements and preferences?
Oh yes, definitely. uh,
Right.
Anyways, talking to an adult is different, talking to a child is very much different. Okay, and
Absolutely.
when it comes to a special child, a child with autism, uh, every minor word that you are speaking, the
Yeah.
tone that you are speaking in, the expressions that you are having on your face, every minor detail is being observed by that child. Okay, we
Right.
might not realize it, but the child is very, very observant. So
Right.
whatever you are speaking, first of all, see, these patients cannot uh, distinguish or uh, read in between the lines. So we have to
Right.
be straightforward. Okay.
Right.
If we want to do a filling, we'll have to tell them that we are going to do a filling in your mouth. We just cannot say that we are going to put toffee inside your mouth so that your teeth can be better, or put something like we do it for other children. We cannot use euphemism in these children. So we have to
Right.
be very particular with what we are speaking.
Right.
Then these children are also very imaginative. Okay,
Okay.
so using different forms of story,
Right.
inculcating whatever you want to say in a story format or in a musical tone helps these children a lot. So
Right.
this is how we can go about the communication part. Also, parents play a very important role here.
Right.
At times, these patients will not coordinate with you or will not respond to you, but
Right.
it is your responsibility to get all the medical history, the dental history, and all the conversations that you want. The
Right.
dentistry cannot be practiced without conversing between you, the patient, and the parent when it comes to pediatrics. So here the parent is supposed to be the mediator between you and the patient. So wherever
Absolutely.
you think that you are not able to communicate properly, you always take parent as your support and then communicate.
Right. So, of course, storytelling and parental approach are the best communication skills to reach out to such people or such children. And
True.
so, as you just mentioned, that these children are, very sensitive and they're very observant. So, considering the many triggers that may cause autistic children to feel uncomfortable or experience sensory overload, especially, in a dental setup. So, how can we provide them a sensory friendly environment in a dental office? And I mean it in terms of lighting, noise levels, physical space that can actually be altered to improve their comfort and cooperation.
See, very frankly, dental setup is one of the most um, sensory generator kind of place where
Absolutely.
everything is so loud, so bright. Um, Everything is just lit up, whether it is
Right,
light, noise, smell, colors, everything you will get.
right.
Anything to, especially when we talk about pediatric setups, they are so colorful.
Yes.
General population will enjoy these things, but autistic population finds it really difficult to adjust and adapt to all this setup.
Okay.
So very important point should be remembered. Okay, first of
Right.
all, on the parents part, please take a pre-appointment schedule. Okay,
Okay.
schedule an appointment beforehand, inform the operator about the condition of the child, so
Right.
that you as well as the operator is prepared about the treatment that we are going to provide.
Right.
When you are entering your dental clinic, what all
Right.
can you expect when you are bringing your child to when you're bringing the autistic child, right,
Right.
for getting the treatment done. So we we provide a dark room. Okay, we
Okay.
tend to switch off all our lights, close the windows. If possible, we put on the curtains also. Okay,
Okay.
and there are very mild lightings which are present so that it is not absolutely dark. Very mild.
Right.
The lights are so mild that it is very relaxing. Okay, the
Right.
ones that use while sleeping, the blue lights, we use them.
Right.
Secondly, we advise the parents to get noise cancelling headphones. Okay,
Okay.
if they don't have that, or if the patient is okay with having a headphone, we can play soft music on that. If the patient is okay with music being played in the surrounding also, we put it on the music system. Okay,
Right.
so this is how sound is taken care of. Then
Right.
we ask the patient, either they can get a heavy blanket, or we have a different kind of, we have made, usually it is called a butterfly wrap. Okay,
Okay.
so we just close the, like we have the proposed food, okay,
Okay.
similar to this, but it is not to restrain the child, it is just to make the child feel like he's being hugged, okay,
Okay.
like they are being hugged so that they feel that they are in a secure place. And
Right.
the as comfortable the child can be, the
Right.
better the child perform. Okay, if
Absolutely.
all these things are taken care, then we also consider patients who have a lot of gagging. Okay,
Right.
these children, there is a lot of gagging reflex that is seen. So for them, distractions can be used. We can use topical anesthetics, of course. Then what else? So there are a few things that we can follow for gag reflex.
Great. And after providing them a very calm and a comfortable environment, if the first appointment is conducted well, then how can a dental specialist encourage consistency and routine in oral care regimens for such children? I mean, could you provide some strategies that could be used to make these kids more comfortable and eager for their future dental appointments?
To create any kind of sensitization, I think as a society, there are many people who come across or come in contact with our autistic children, right?
Right,
Firstly, the parents and the caregivers, siblings,
right,
immediate family members, the
right,
pediatrician, and then comes the pediatric dentist. So,
right,
early as possible in the life of the child, a dental appointment should be fixed. That is where the concept of dental home comes in. Okay.
okay,
Secondly, even though the child is not cooperating to the parent, still oral hygiene should be followed. It will take
right,
time for the child to adjust towards the oral hygiene procedures, because seriously there is a lot that goes inside your mouth when you are even brushing.
right,
Okay, so for the child to adapt that, it will take time, but patience and perseverance works a lot. So the parents have to be really be dedicated towards all this functioning.
right,
uh, when it comes to the first experience, on the dental part, we try our level best that we always give a positive experience to the child.
right,
Positive reinforcement after having a good dental visit is important. I think
right,
uh, encouraging the child is really important. After you complete a
right,
dental appointment, minor things, if you can just give a child a small treat, or take the child out for a walk, or do whatever the
right,
child likes, it will
right,
just throw back, in the sense like it will help the child to feel okay, if I get this thing done, I'll get this
right,
thing in return. So it
right,
helps child. Regular follow-ups with your dentist.
right,
It should not be limited to pain phases only. Even
right.
though child is absolutely fine, you should at least visit the dentist once a year. For
Okay,
special children, those with higher risk of dental caries, we demand the visits up to like in 3 months or 6 months, depending upon what the rate of caries in them is. So these things, while getting your child to the clinic, uh, you should allow your child to get their favorite toy. Anything that will relax the child can be
right,
brought. That will help the child a lot. While
right,
practicing the oral hygiene measures, I would like to mention a few things. Um, when you're brushing your child's teeth, in very young children, they will not be stable. So you will have to
okay,
hold their head from behind and then clean their teeth.
right,
Eventually, they start adapting to their motion. These
right,
children also have lack of motor coordination, correct? So
right.
you cannot expect like any normal child, they'll brush their teeth by the age of 4 or 5 years. You will have
Absolutely.
to continuously supervise them.
Right,
Electric toothbrush have been found to work better in these children, but not all children can adapt to the sensation of that battery or motor vibration. So
okay,
whatever suits your child, go ahead with that. There are
Right.
many doubts. Many people ask this whether the child will swallow the toothpaste. Is it okay? See, the toothpaste that we advised for these children is fluoride based, and ingestion of fluoride based toothpaste is not recommended. Okay,
Right.
so it is always advised that you ask the child to spit.
Okay.
The quantity of toothpaste is very important. We just
Right.
take a bulk of quantity on the toothbrush and we try to brush. It is not how it happens.
Right.
Specific amount of toothpaste, like a pea size or two pea size, depending upon the age of the child, the
Right.
toothpaste is sufficient enough to brush all the teeth in your mouth. Okay.
Right.
Once toothbrushing is done, like normally we floss using a dental floss. In
Right.
these cases, we can go ahead with a jet flosser or water flosser.
Okay.
Water flosser is quicker, and
Right.
uh, the child will also rinse off that remaining toothpaste. So it
Right.
works in a fashion. And lastly, you can use stain. Okay, the discoloring agents that are present, which will
Right.
stain the brush. It uh, it helps to increase curiosity in these children. See, these are the dirty areas, and we need to get them clean. So you can hand
Absolutely.
over a mirror in hand of your child, and you can brush
Right.
their teeth or ask them to brush their own teeth.
Right.
Eventually, by slow and consistent working, this oral hygiene practice will become a routine. And
Right.
there are kids which we have, if you don't follow this routine, they become annoyed now. So
Absolutely.
this is how we can go ahead with autism.
That was very informative, Dr. Shivani. We are grateful for your presence today. I am hoping that this discussion would promote empathy, knowledge sharing, and cooperation in our shared goal of giving autistic children compassionate and successful oral health management. Thank you very much for joining us today.
Thank you so much, ma'am. I just want to add one line.
Please,
See, in our country, there are n number of children, correct? There are
please.
many children who are having special needs,
Right,
and it is our responsibility to consider them our family only. So
right,
I have published a book on that, by the way, and it has a line that these people are not different; they just have
right,
different requirements.
right.
So as much empathy, love, care that we can give to these children, it will be great for our society itself. And I'm
Right.
very, very
Abs-
thankful for being invited by you. Thank you so much.
Thank you so much, ma'am. And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again, Dr. Shivani. That was a very insightful session.
Thank you.